Hey, Dr. Cole, how are you today?
I'm good.
Good, good. So my name is Shawn Crawford. I'm from PatientIQ here to talk to you about ENROUTE. First off, just maybe talk to a little bit about yourself and where you work at.
Thank you. So I'm an orthopedic surgeon at Midwest Orthopedics at Rush. I'm the managing partner and acting chair of the department, and have been very involved with Patient IQ in terms of implementing it within our practice, as well as working with EMN to implement ENROUTE to our practice from a clinical perspective.
So when you implemented, talk to me a little bit about that process and how do you get that information to their patients?
So the first thing is you have to have clinical buy-in, and I think we had that very early on with most of our clinicians. Our patients are really looking for something in addition to traditional recommendations. They like a holistic approach to their care. So understanding that protein supplementation is useful, all the aspects of sarcopenia, potentially reduction in infection, enhancing recovery, all of those things I think can be translated to what we do every day. So that was the start to make sure we had clinician buy-in. But from a rollout perspective, it actually was quite easy. It started most like any other new product, or sort of like a DME that we work with our clinicians, having assets that are available in the examination rooms was a start, but also educating our physician assistants and our nurses, and as well as our support staff who schedule surgery and so forth, because this is it's a educated sale, if you will, in terms of helping patients understand what the role is. So it was very easy early on to implement it into our practice, essentially based upon having takeaways, paper assets, and now digital assets within the office. But we've expanded that much further now as a sort of a fail-safe, and we have multiple touch points with our patients to assure that they're educated early on. Certainly, we're hoping within 2 weeks of their surgery, and then how they continue it post-operatively.
Now, you mentioned you were moved from paper to digital assets. How has that affected the patient's adoption of it?
So I think having the paper is helpful, but a lot of our practice has actually gone digital. So having something to give to a patient that's an easy to read brochure can be helpful. But we've actually done several things. When patients schedule surgery, our clinical coordinators actually will either have paper or have a scannable code that patients get information and go directly to a link to get that to source the ENROUTE. At the same time, we're using Patient IQ, so that's another layer, which is a patient engagement platform that not only helps us collect patient-reported outcomes, where our compliance has actually been very high, it also helps us engage patients pre-surgically and post-surgically so that they can learn more about the protein supplement, and at the same time order it and get it in a timely fashion.
So I like that connection. So as that patient gets the education and then orders that supplement, you get the supplement prior to the procedure and then the supplement after the procedure. How have you found patient-reported outcomes to be useful in tracking that outcome of actually taking that supplement?
I mean, I think part of the issue is compliance. So Patient IQ, because it has a high level of engagement with our patients as they go through a clinical track or a clinical pathway, is particularly useful for tracking outcomes, and in some fashion or another, I think we're going to get more data as it relates to how patients are doing, whether or not they've actually used some type of supplementation pre-surgically or post-surgically. So the same compliance that we get on our PROs or patient-reported outcomes, we're now increasing in terms of our clinical access as it relates to ENROUTE as a nutritional supplement.
Perfect. Yeah, it's funny. My relatives actually, my father-in-law got his hip done, and my mother-in-law is getting her shoulder done.
Yeah,
it's nice. We got the pre-education prior to it, and then which allowed my in-laws to ask questions with a surgeon like yourself, kind of prompting them of the benefits of a supplement like this and helping out in the recovery. So it's been a phenomenal tool from their perspective too.
Yeah, I will tell you that I think patients really appreciate it. They, as I mentioned, they like a holistic approach. Not, obviously we're always trying to keep patients out of the operating room when possible, but when surgery is warranted and that's the best solution, rounding it out with nutritional supplementation I think is a big advantage for our patients, and they know that we're thinking about their overall well-being.
Yeah, you're ultimately hearing their voice, I think, is a good way of putting it.
I agree.
From this personal question, what's your favorite flavor?
The coffee.
Coffee?
Yeah.
All right.
Yeah.
Good, good.
You call it mocha or you call it coffee?
Mocha, I think.
Yeah. Okay.
Last question is just what do you see from a surgeon standpoint, but also your position at Rush as the chair and a leader at Rush? What are the benefits of including ENROUTE into your practice?
Well, I think one of the most important benefits is that it allows our patients to understand that we're thinking about their overall well-being. So it's not just, hey, here's a solution that involves surgery to get you back, to reduce your pain, improve your function, but it's also helping them understand that we're thinking about other aspects of their health,
Yeah.
and nutrition is a very big part of it.
Yeah.
So protein supplementation has lots of benefits that are widely known, in addition to their benefits in a surgical setting, which might be reducing sarcopenia, muscle atrophy, potentially reducing a chance of infection, weighing in on the whole recovery process.
Yeah.
It also relates to how they manage insulin and glucose and so forth perioperatively. So it's much more comprehensive than just taking a protein supplement. I would say that patients understand it. It's widely understood, the value of nutrition in general in terms of protein supplementation. So it resonates. They come in with a fairly good knowledge base, and the fact that we're providing an avenue for them to do this in a very simple way has actually, I think, been very beneficial, and patient acceptance, and in addition to surgeon acceptance, has been very, very high.
Yeah, I think one of the aspects coming from like the combination of patient IQ and ENROUTE, the aspect that you're always engaging the patient and asking information, but you're also being like a symbiotic relationship by providing them value as they go through this instance of care with you too, as well, is very valuable.
I would agree with that.
Again, Dr. Cole, thank you very much for the time here today, and I appreciate the support you've been able to provide and the outcomes you've been able to provide your patients.
Thank you, Shawn.
Thanks.